What's up, everybody? It's Dr. Scott with the Full Body Fix, and today we're going to cover directional preference in rehab. What does that mean? We're specifically talking about lower back pain and finding a patient's directional preference, meaning which way does their pain respond better to, and how can we use that in therapy to help speed up their recovery from that issue. This is a great companion to our video on sacroiliac joint pain being a disc problem, so definitely check that link out. Come back here and we'll teach you a little bit about how to get started. Okay, so simply directional preference is two motions we're looking at today. Flexion versus extension of the low back. Flexion, extension. And when people are suffering with low back pain, what I often will do is test both of those motions and determine, do they feel good, bad, or no different in those positions. So have them do flexion, good, bad, or no different. Have them do extension, good, bad, or no different. Now, by and large, when we're checking people with lower back pain, especially those who think they have sacroiliac joint pain, and in fact do have pain in that region, but that it might be coming from a disc, they often have flexion intolerance, meaning they can't flex the lumbar spine. The quick way to look at this is actually more in a cat-camel position. So just have them do that all fours. And see, most people can drop into extension, that position. And oftentimes folks with lower back pain have limited flexion, a limited ability to actually flex the lumbar spine. And what you can do is actually just take something straight and put it across the low back and see and actually measure that lower back flexion. If it indeed does come out limited, obviously from a manual therapy standpoint, we want to get in there, break up any of the soft tissue adhesions in and around that low back to start getting that lumbar spine to flex easier. So let's do three really basic ways to start influencing lumbar flexion or low back flexion. You can actually go right back into our testing position and drill repetitively that intersegmental flexion of the spine in that angry cat position. The reason I like these is that as you exhale, you can sort of start thinking about each individual vertebrae flexing over the individual joint segment. And I'll start from just neutral and press up, really exhaling and flexing through the low back. We do that about 10 times, 2 to 3 sets. Go onto our back. We'll do the same sort of idea, really flexing the spine in a pumping action, which will also help repair that disc by creating a change of pressure in the disc. And just do some single leg flexion. We'll just alternate, holding just a second or two on each side, 10 times each leg. After I do 10 on each leg single, I'll also just kind of rock up and really try to pull the low back up off the floor. Tuck the knees to the chin, to the chest if you can. If your knees are bad, just come and grab behind the legs. Again, a couple sets of 10. Lastly, we're going to try to get a little bit of elongation and decompression in the low back by doing child's pose, or I'll also show a version using the stall bars if you have something to hold on to. So child's pose, again, is just trying to sit back the butt to the heels. And then the stall bar version of that, I'm going to have my back to you here, is just grabbing on and sitting back into lumbar flexion. You can also do that with a rig. It's been Dr. Scott with the Full Body Fix. We'll see you next time.